areas with minimal pain and amazing results. Dr. John McHugh is here with the answers. Welcome, sir. And you know, a lot of ladies and men have varicose veins. They talk about varicose veins, but what exactly are varicose veins?
Varicose veins, we've all seen them. We know what they are if you have an old grandmother, apparently. They're the probably most common patient population you'll see. But technically, varicose veins are bulging veins that are above, you can see them above the surface of the skin. They're unsightly. They're typically bluish or purple colored. They're common. Some estimates are about 40 million people in the United States have varicose veins. And an important thing is that varicose veins are really not just a cosmetic issue. Certainly they are unsightly, but they're more of a medical problem than that. Most of my patients, the most common presenting symptom is achy pain, especially after a long day of being on their feet. So especially in professions, hairstylists or other people that are on their feet a lot, waitresses.
Doctors who are on their feet, nurses that are on their feet all the time.
So there are many, many professions, but that's not it entirely. There are many people who can do that and not develop varicose veins, but there's a definite genetic predisposition. Most patients that have varicose veins have parents or grandmothers that have had varicose veins. And as you mentioned, it is a lot more common in women, about twice as common as in men, but I see a lot of men in my practice too. And the men don't come in until they really start hurting and causing problems.
Right. They can be unsightly, but yet not painful at times, correct?
Yeah, and early on, you may be lucky and not have any symptoms, but later on, most patients will start to develop pain. And the pain and the symptoms are usually progressive. They get worse as the patient gets older. And varicose veins in general are a lot more common. Some estimates are, if you look at women in their 20s, maybe only about 5 to 10% will have them.
My next question, where are we looking at time-wise, age-wise, as we get a little bit older? In their 20s, how many percent?
I see women early on. I've taken care of patients in their late teens is probably the earliest. Pregnancy certainly makes them worse in women. If you look at women in their 60s and 70s, the prevalence, meaning the number of people having, maybe as high as 70% of women will have some. And as I said, it's not really just a cosmetic issue. In addition to the pain, later on in the later stages, you start getting swelling of the legs and inflammation of the skin, and elderly patients can even develop venous ulcers, meaning a big sore on the skin that doesn't heal and can take months and months of wound care and other therapy to get treated.
It can be very painful. How do we treat this? You're talking about laser treatment today that's painless, if not just maybe a little bit, some very minor.
Minimally invasive is the term I like to use.
Let's talk about that.
Going back historically, veins were treated by treatment that had relatively good success, but were a couple days in the hospital. It's called vein stripping, and they'd remove the culprit vein. We direct a lot of our attention at what's called the great saphenous vein, and that was a surgical procedure with large incisions at the groin and at the knee, and they would remove that vein. About 15 years ago in the United States, much more elegant techniques became popular, where we make just a small nick in the skin about that big, feed a small catheter in, and use heat. In our case, we use a laser device to heat up the inside of the vein and cauterize that vein. And that takes care of the main problem.
Okay. What should a patient consider when choosing a facility to take care of the varicose veins?
My advice is, talk to friends, family. Everybody looks online these days. Look around.
Talk to patients that have been there.
Find a center that is got a good long track record. In my case, I promote our practice, which is Invisivein. We've been providing varicose vein therapy in Mount Pleasant since 2003, so about 15 years of doing excellent care. And I encourage people to, they should click with their doctor. They should get good vibes when they're having that face-to-face encounter with their physician. And if in question they don't feel comfortable at a particular place, they should seek a second opinion. At our place, we always give free second opinions.
And we only have about 10 seconds left. About how soon can people see results from that?
There's a little bit of pain immediately after the procedure. I'd see them all, within a couple of weeks, they're definitely going to be feeling better. At the 1 month follow-up, they're happy and their legs feel great and look great.
Where can we find you, doctor, here in the Mount Pleasant area?
We're at the intersection of 526 and 17 here in Mount Pleasant.
Doctor, thank you so very much. Stay with us. We got more with Low Country Live right after this.